Welcome back. In this video, we will be talking about implants. Implants are a great way for our patients to replace any missing teeth. An implant is a titanium screw that is placed in the bone of the patient, onto which the abutment and finally the crown is placed. Bone grafting may be needed prior to placement of implants. At our office, we start with placement of the screw into the bone. The gum tissue around the screw is sutured, covering the screw. Now the area is allowed to heal from 3 to 6 months to allow for bone to form around the screw. Post-op instructions are mandatory and must be explained to the patient to ensure that osseointegration happens during the healing process. After a few months, when the patient returns, the doctor accesses the implant site by surgically removing the gum around this area. He places an abutment onto the screw, and the gum around the area is now sutured back at the neck of the abutment and not over it. The implant will now be visible in the patient's mouth. Once this is done, final impressions are taken for the crown seat, and the crown is seated at the next appointment. So let's review the 4-step implant process. Step 1, obtain the implant and the general consent from the patient. After you have set up the tray and the doctor has addressed all the concerns and questions of the patient, start with an X-ray if one has already not been done in the last 6 months. The doctor will anesthetize the patient, and the doctor and assistant will work together to place the screw into the bone. The doctor may ask the assistant to take additional PA X-rays. It is also important for the assistant to record any lengths used by the doctor during the procedure. Typically, this relates to the length of the drill in millimeters or the length of the screw that the doctor used. Post-op instructions are given both verbally and sent via email by the assistant to the patient. At the next appointment, which is step 2, a general consent is obtained. The tray setup is ready and a PA of the area is taken by the assistant. The doctor now proceeds to review the area and sets up the next appointment for placement of abutment. At the 3rd appointment, again, a consent will be obtained from the patient in writing, and a tray is set up for an abutment and final impression. Shade selection and consent of the shade selected is got from the patient, and confirm the type of crown that the patient has agreed to get. Is it a PFM or an APC? There are no temporaries that are placed over implants. The next visit is scheduled for crown seat. Step 4, the patient returns and the crown is seated in place. Let's take a look at the implant kit. Remember, it is the assistant's duty to have all materials available on the implant kit and to provide the post-op instructions. It is also your responsibility to obtain the implant consent form and the general consent form from the patient. Because bone graft may be required during the implant procedure, it is a good idea to have your bone graft kit ready and available. Don't forget, should the doctor decide to do a graft, it is your responsibility to alert billing prior to starting the bone grafting procedure and to obtain the consent from the patient prior to starting the bone graft procedure. Please feel free to review the bone grafting video, which is a part of the extraction video on our website. Thank you.